So I'll start with the questions as Dr. Rania looks at the questions. A couple questions came in general about kind of helping, how do we raise suicide awareness, certification. And as Rania mentioned, Maristan has a program. The FYI also has workshops for the communities to address suicide prevention, intervention, and postvention. And one of the things, you don't have to wait for any one of us organizations to come into your community to do those trainings. If you go on the website, and you type up the FYI suicide prevention resources, there is a prevention workbook that you can start implementing in your community. One of the things that communities have done is there are infographics we have on their website. You print it up, it's out there in the bazaar, on the way to the bazaar. Those large infographics, if you share them and put them around in the masjid, you help start the conversation about suicide. That if you are struggling, get help. We are a space where you can talk about mental health issues. Khutbahs on the topic of suicide. And again, like Rania mentioned, if you are able to help destigmatize and create opportunities for people to get help, and they know where to get help, we're able to save lives, right? And so the more information that you individually can do, because it's not gonna be just Rania and myself doing this work. It's all of us collectively making those safe spaces, helping connect individuals who may be struggling to the resources that they need, when they need it, how they need it. And so recognize that each one of us has a role to play in making changes in our community.
MashaAllah. So there's a couple of questions, and I'll maybe kind of combine a couple of these because there's some technical questions here. There's one related to is the training virtual and how do they get certified and so on. And I think Dr. Sameera began answering some of these. But I'll also tell you, important as well, the manual that I'm referring to at the lab is something that's free. Alhamdulillah, it's something that you can, but it's of course a research manual. So it's 100 pages, mashallah. It is dense, but a very important information. We tie in the evidence base of the most current knowledge related to suicide in the field of psychology, psychiatry, along with kind of marrying it or coupling it with Islamic ethics, morals, and fiqh. And so there are questions here of people asking very specific things, like, for example, on fiqh, masail or answers on, burial and funeral rites and janazah and so on. All of these things are actually dealt with in that manual. The reason we did the training is because we found that you can't just hand an imam, let's say, a 100-page manual and say, here you go, mashallah, even though it's there and downloadable and available. So what we did instead in addition, is actually form that training. It's a full-day training, but it's very interactive, and it's the kind of thing where you role play and have the kind of skills that when you go out to your congregation later, or a youth leader, for example, and you go out to work with your youth later, you know what to say and how to say it, and what to do exactly. And so that's the training. The third thing I want to say very similarly actually to FYI, we were very careful in listening to what the community needed. And one of the main things we kept hearing from the people we were training is, give us very practical things. So there are a couple of articles of like do's and don'ts that you might want to access. If you go to our website at maristan.org, there's the resources there. And we have articles published on Muslim Matters, for example, on what do you do in the aftermath of a suicide in your community? What do you say? What do you not say? How should you be careful? What are the 5 steps? What are the 10 steps, right? Same thing with prevention. And also khutbahs. We were very careful because the imams were saying, in fact, one of the imams back in that incident I was telling you about was so shaken that on the Friday, on the minbar, on the Friday khutbah, it was so overwhelming. He said, I literally just printed out your khutbah and we kind of wrote this and made sure that it was meeting the criteria for prevention and postvention, right? Because we have 2 different khutbahs written, but also all of the fiqhi correct way of doing a khutbah. And he literally read it line for line. And it's so difficult in those moments. And those are free and available. You just go to our website and you download them directly and give them to your imam, inshallah ta'ala, as resources. The person asking for virtual trainings, inshallah, once we do some in-person certification trainings throughout the country in 2022, we plan to then adapt it into virtual and make sure that it's available to all people in all communities. So you're able to access, inshallah, in time, both things.
Jazakumullah khair.
So there's another question that says, what if your parents have trouble understanding your mental health needs and are not supportive of therapy? How else can we seek help and improve our well-being? And it could be incredibly hard trying to deal with mental illness proactively alone. And this is something that we're increasingly seeing as young people start recognizing that their struggles are real and that they do need professional help. Couple things that you can do. One is really try to understand where your parent is coming from and kind of understand, like, is it stigma? Is it lack of information? Is it, what is going on? Is it the fear? If you can figure that out, and there are a number of resources that we do have to help people understand, well, what is the impact of not getting support? Right? I was just talking to somebody about something very common, like ADHD. Right? ADHD is very common, and it's a cognitive issue. It has nothing to do with environment or any of that stuff. It's a cognitive issue. There's a genetic component, all that kind of stuff. And I was talking to him, and I'm like, did you get tested? And he was like, no, man, they put things on your head and this. I'm like, what are you talking about? Like, that's none of that stuff. There's so much fear that we don't know about. And then he was like, well, I haven't taken medication. I'm like, dude, like, you need to, if you have diabetes, if you have blood pressure, are you not going to take medication for that? Like, these are things that are simple issues, and when they're not addressed, ADHD then develops into depression, anxiety, and major issues that it has to do with the self-esteem because of the fact that say for example you're missing different things. You're not grasping, because of the inability to pay attention. You missing half the conversation somebody's having. Well, then you're trying to figure out what they said, and then then you mess things up, and then your self-esteem gets impacted. When your self-esteem gets impacted, then it impacts your ability to be successful. Like, it's a simple thing that could get fixed easily. So again, if your parent has those kind of misgivings, really try to understand where is that coming from. Right? Then the additional thing you could do is find individuals who can have an impact on your parents. If you have tried and you've explained to them, like, if I don't get help, what is the impact? Again, going back to ADHD, young people who do not get treated early on have a higher risk of engaging in risk behaviors like alcohol use, premarital sexual activity, alcohol, all of that type of stuff. They're more likely to get into that. Helping your parents realize, like, this is the alternative. Do you want this alternative for me? Right? Advocating, get mentors, get your pediatrician, get the imams, get other people involved who are mental health advocates to advocate for yourself. Find out from the school, do they have resources locally available? Multiple different things. And then available online. One of the things that we do at the FYI is we clinically vet the resources that we do provide that we don't produce, to make sure that whatever we are providing, you have that information. So educate yourself on that. And recognize that there are many different resources out there. You just want to make sure they're clinically vetted, because there's a lot of garbage out there.
Jazakumullah khairan to both of our speakers today.